Hi everyone, Ollie here and welcome back to the channel. We're doing another kind of fortnightly week wrap-up diary video. I'm just going to jump straight in because this one is going to be about the last 2 weeks of Block 4. So heading back to not last Monday but the Monday before now, because I'm recording this on the first Monday of the Easter holidays, but nothing actually happened on the Monday, so we're going to skip to the Tuesday when we actually had our first kind of paediatric kind of patient encounter. It wasn't the patient themselves wasn't a child, it was actually the mother that we were there to see, who had her own kind of reproductive health problem. But it was quite awkward because we were given a slightly wrong address by our community manager, and we ended up going to this woman's house, completely the wrong house, and I went to go and knock on the door and no one answered, but then this old lady popped out of the window kind of telling us to go away, sounding quite angry and frustrated, and we thought we were at the right house, so we were sort of trying to go, no, like, we're not selling anything, we're not salesmen, we're medical students. And she for some reason thought we were Mormons. I think we were all dressed pretty smartly on the day, as you're kind of expected to be for the community days, but Mormons is a new one for me. But to focus on what I was actually going to talk about, the point was that this patient, the mother that we were there to see, had her own reproductive health issue going on, but she also had this baby that was there when we went to see her. And I think it's a slightly odd perspective, but I'm going to put it out there in that I drew a strange parallel between an earlier case I'd heard about where I think there was a patient met by another group who had, it might have been multiple sclerosis or something like that, like a quite debilitating condition. But this lady with MS had a son with muscular dystrophy. But this lady with MS had another family member with a similar condition that was also very debilitating. And in that situation, her own care needs kind of got put to the back because she was spending all her effort looking after this other person. And I think her self-care maybe kind of dropped off. She didn't put herself as the priority in that situation. And that was absolutely true in this case because this woman that we were seeing had this, not newborn, but still very, very young, like a matter of months old baby. And, you know, I think this is probably true of virtually all parents, but she was very, very hard on herself, and she was doing a really, really good job, especially given her background that she told us about with this baby. She was doing an amazing job, like she sounded like an incredible mother, but she was not kind of prioritizing her own care. She's just putting everything into looking after this child. So I think that weird parallel can actually be drawn there, that because she's a new parent looking after this baby, she is as vulnerable in that situation to damaging herself as would anyone else in a long-term caring position. The thing I've kind of been doing a lot of much more recently is putting together proper revision resources. So you might have seen some of my other videos that I was talking about having worked on the brachial plexus, which is the kind of series of nerves that control the motor function for your upper limb, and the different ways in which they can be damaged. And I think it's one of the conceptually more challenging things, neuroanatomy aside, that we've had to deal with so far. It really, for me, had to be presented in the right way for me to properly understand it. And so I put a lot of time into putting together a big A3 poster. And we have a Facebook group for our year on the Warwick programme, sort of affectionately referred to as the JEP page, for Graduate Entry Programme, GEP, and we can all share resources that we make with one another. So I put it on there and it got really, really well received, thankfully, and more people are starting to do things like that. It's a really nice kind of collaborative, with a really good culture of sharing environment. I'm just going to skip right ahead to hospital of last week. So the week before last, obviously hospital was cancelled. I think I put in one of my videos because of the snow. Thankfully it wasn't cancelled in the week that I'm now referring to, so we learned how to do, it was shoulder, so sort of checking integrity of the rotator cuff and things like that, and close examinations of the hand as well. We're starting to do a lot more OSCEs now that they're much more focused on one area, whereas before we started with a lot more kind of systemic exams, so things like abdominal, cardiovascular, respiratory. You're looking for very kind of general symptoms, how they might manifest on the back of the hands or in the face or whatever, whereas now it seems to be this kind of much more focused approach on a particular area. And the reason that I bring that up is that I think the ones we've done more recently are actually the easier exams. I think we did the harder ones that have more steps to them at the beginning. Certainly neuro has a lot of steps to it just because of the number of things you have to test. Cardio and resp each have a few special kind of one-off maneuvers that you can do if you can remember, but the more recent, like spine, hand, shoulder, everything like that, they're kind of small, simple, and you can just get on with them. The weekend I basically spent timetabling, because I'm kind of doing this in the past, so I have a ton of revision to do over Easter. We have 5 weeks for Easter. I've made a 4-week revision timetable so I can smash out a block a week. That's the goal. At least it gives me some contingency if I'm not able to do that. But it took me a long time to put together, and again, this is now done. You can see a picture of it on screen, and I shared it with the rest of my year, and I've had some really, really nice messages from people, so I think some people are actively going to use it, because what I tried to do was group all of the different tasks we have to do, not only by block but by kind of general area. So you do a couple of days of gastro, a couple of days of kidney, a day of heart, a day of eyes, that kind of thing. Everything's grouped together so you're not jumping about between days. And that weekend I also went and picked up some gifts for our 2 community leaders, because that was actually our last community patient, the mother and her baby, that situation, and we wanted to just say thank you to the 2 women that had looked after us during our placement in that GP clinic. So they seemed very happy with that when we presented them. On Monday, so this Monday just gone, I went to a talk in the evening. Well, I was actually asked to film the talk, but I would have gone to the talk regardless, by Chris Lovejoy, who is, I think he's an F1 doctor. He's either F1 or F2, but crucially he's a Cambridge graduate, did very, very well, and is the older brother of someone in my year on the course. And so he came and he gave a talk on, he's written a book called The Modern Medical Student Manual, and it's kind of ideas and advice on how to get the most out of your time, how to study efficiently, how to succeed in medicine, that kind of thing. And I bought his book. I don't have it to hand, but I will put a picture of it up on screen and put a link in the video description as well. It was a really, really good talk, and it will be up, I believe, on Chris's YouTube channel. At least parts of it will at some point in the future. It was just full of good revision techniques, things like spaced repetition, Pomodoro timer methods, things like that. Just the scientifically proven ways to absorb and retain knowledge and achieve flow when working. The Tuesday we then presented our 3rd community patient, so that was our last patient the week before. We then had to deliver the case presentations. That went perfectly fine. We ran over time a little bit, but I don't think anyone really cares. And we were able to get some really good one-on-one feedback on the reflections that we'd written about our time in GP placement. That was really, really useful, and I've actually really enjoyed it. I did express interest in trying to come along to the clinic if there were any opportunities over summer or in the holidays or whatever. I think it's a really valuable thing to be able to do. Then Wednesday night was another talk. We're very, very busy. It was the general surgery evening. So the Surgical Society at Warwick have been doing these series of events called So You Want to Be a Surgeon, with evenings focusing on different specialties, and this one was focusing on general surgery, which I've always thought of as sort of abdominal surgery, kind of everything in this kind of space that isn't done by a cardiothoracic, but sort of lower down. And that actually turned out to be really not true. They do a ton of different things. depending on their subspecialty, and there was a vascular surgeon, I think colorectal, endocrine, and again, I mentioned this before when we had the neuro evening. I went along to see one specialty, so I was really interested in the endocrine surgery speaker, and just like with the neuro evening, I went along to see the neurosurgeon talk. At the neuro one, I was completely blown away by a specialty that I'd never heard of. The stroke medicine presenter, Dr. Banda Dalal, stroke physician, I should say. He knocked it out the park, kind of blew everyone else out the water, and it made me think, that's actually a really cool specialty. And the same thing happened at this evening. So I'd gone along to see the endocrine surgeon, and there was a hepatopancreatico-biliary surgeon called Dr. Barney Stevenson. Or it might be Mr. Barney Stevenson, actually. He just presented it really, really well and made it really, really interesting. So really, I think whenever you do go to these talks, go with an open mind, because you'll be pleasantly surprised. And all 4 of the talks from that evening are available on my YouTube channel, so if you'd like to watch any of them, including the HPB surgeons, you can find them all on the channel. Thursday was all about our upcoming exams, so I think my first one is on the 4th of June. It's about 10 weeks away, my exams. I'm terrified. But I think the uni did a really, really good job of explaining to us everything we need to do to show that we've engaged, to be allowed to sit. They explained how the marking works, how the question selection works, how will we pass, what happens if we don't pass. I think they did a really, really good job on what is not a pleasant subject by nature. Then in the evening I sat the Block 4 formative, because I like to get them out of the way as soon as they appear. So they open on a Thursday morning at 9 AM usually and run through until 5 PM the next Wednesday. I like to get them done the same day, so I don't have to spend the weekend studying for them. And thankfully I passed pretty well, without much preparation. I've really enjoyed Block 4, the kind of orthopedics, musculoskeletal one. It's all very logical, all about muscle. This is not the best example of muscle movements, but you get what I'm trying to say. Then Friday was also really, really cool. So we had clinical skills, we had palpable masses. It was kind of dermatology and palpable masses. So having a look at different skin lesions, which are gross, but it was like technically what is a cut, what is a blister, what is a papule, what is a macule, all these various disgusting words that you've probably heard before but never been quite sure what they refer to. We did that. And then we did some thyroid exam revision as well, which I managed to make a pretty good job of, despite having not practiced it since our Moskies at Christmas. And then I did have to ask, but I was allowed to leave the session a tiny little bit early because I wanted to catch the optional neuro teaching that was on at lunchtime, and it was the other side of the hospital on one of the trauma wards, but it's put on every week for free, attended by doctors and students. And it was on interesting cases in neurosurgery, which obviously very interesting. So a few of us students went to that, and it was really, really good. There were about 10, 12, maybe not quite that many, definitely 10 consultant neurosurgeons in the room. And it became what I would only describe as a sort of funny pissing contest between these consultants who couldn't agree on because it was an interesting case, so they got up scans and things, and we talked through them, and they were just having disagreements with one another and going, just Google it, I don't know. But it was really grounding, actually. It was very, very funny, and actually very nice to see them behave that way in that environment. And we got a lot out of it as well. It was a really good chance to go over some neuroanatomy, put it into clinical context. And then after that, one of the neurosurgeons who had been leading that session has been assigned as my sort of mentor, my neuro mentor through the Neuroscience Society that I'm part of the committee of. And so I spent the afternoon with him on one of the wards. But the big thing for me, so the big thing I learned, and I wrote a reflection after this because I'm going to start trying to do that when I see something new, is it was breaking bad news. So essentially the news was this particular case, they weren't going to operate. and it was likely the patient was going to die reasonably soon, and there was a DNAR involved as well. And so basically I went in, watched the consultant kind of deliver this news and explain. It was a very heartbreaking case, clearly, to the family of the patient, and like, God knows how he was doing it. I could barely look at them, the family, like, while he was delivering this news. I could barely look at them, never mind him actually delivering the information. It threw me, absolutely. Like, it's the first time that I've ever seen news of that kind of magnitude being delivered to either patients or the families of patients. And he did it, like, I was really impressed. That's what I want to get across. He did it tactfully, he was honest, didn't break eye contact. I think that was the big thing. Allowed silence when there needed to be silence, and, you know, was very sympathetic and empathetic, and did it so cleanly. It would just be, the thought of me trying to do it is so difficult. Like, I don't know how I would handle it right now, but I was so impressed. And he took the time to debrief with me afterwards, which he was very, very good. That's the kind of teacher that I would want to be if I ever had students. Then after that, we went through to it was like a quality improvement meeting. So doctors and nurses and all kinds of healthcare staff had brought forward ideas for improving the quality of patient care in the neuro department, and that was really good to see as well. Went to anatomy afterwards, kind of wrapped up the block, and that was the end of block 4 proper. I did nothing all weekend. I literally just took the time off, kind of saw my friends, chatted, just goofed around, watched TV. I did finish off my revision timetable. It needed some final stages putting in, so I spent a fair bit of time doing that, scripted some videos, but I just didn't want to do much work. And then lastly, I will actually bring it through an extra day and break my own rules. The reason I'm dressed like this is I've actually been in hospital today supporting my colleague Ollie. He's also called Ollie. So there were 2 of us together going and seeing this patient because he wanted to get his second lot of data gathering done for his second case report. I did mine with Jody a couple of weeks ago, but yeah, he just wanted some support, so I said I'd come with, and it was a really interesting case. Spent the day in hospital, so I should have started my revision for the Easter. It's the first day of Easter. Should have started my revision today. Unfortunately, because of the amount of time that took up, I lost today, so that's one of my contingency days kind of done, but I can start and actually smash revision tomorrow. So that's where I'm going to leave it, guys. Thank you so much for watching. As always, please be sure to hit that like button for me, leave a comment, subscribe to the channel. If you'd like to see more, go ahead and check out PostGradMedic.com for more free content just like this. Take care, and I will see you in another video. Bye-bye.